the Reach Alliance Insights to Impact podcast, where research fuels change. In this episode, we explore how Reach Alliance alumni go beyond generating knowledge to actively translating it into policies, programs, and real-world solutions. The Reach Alliance tackles complex global challenges in health, education, and sustainability. Research alone is not enough. How do we ensure these insights don't just stay in academic journals, but drive meaningful change? I am Anila, and I'm a biomedicine graduate from the University of Melbourne, and my research focused on addressing mental health challenges among hardest-to-reach people. We did our research on Atmiyata, which is a community-led intervention to support individuals with mental health illness in Gujarat. I'm currently working as an academic programs officer at the University of Melbourne, and I'm also an impact coordinator for the AFS Youth Assembly. And I am your host for today. So a huge welcome to our guests. I'm so delighted to have all of you here. So let's jump straight into it and start with introductions.
Hello, everyone. It's a pleasure to be here with you today and discuss this super important topic of bringing insights and research and bringing it back to and translating it into evidence. My name is Laura Herren. I was a master's public administration student at the University College London. Our research focused on the healthcare of women with disabilities in Nepal during and after their pregnancy journey. So we specifically evaluated and researched at the impact of specific government changes on the healthcare of these women. And I'm currently located in Switzerland working for the Swiss government.
Hello, thank you so much for having me on the Reach Alliance Insights to Impact podcast. I'm Ibtesaam Moosa. I'm currently a policy advisor at the provincial government here in Ontario, Canada. I completed my Master of Global Affairs from the University of Toronto last year. My project was a local project, so we worked here in Toronto, Canada, and we looked at the disproportionate impact of climate change on Black and racialized youth, and then figuring out how can we propose an accountability mechanism or system that these Black and to hold the city of Toronto accountable.
Hi everyone, my name is Jochebed Afua and I'm from Ghana. I recently completed Ashesi University with a bachelor's degree in computer science, and I am currently working as a differentiated learning in EduTech with UNICEF Ghana. My project was about the no bed syndrome. We looked at the lack of hospital beds in Ghanaian tertiary hospitals, and we sought to research the concept itself, what it means, how it happens, so the causes, the effects, and then possibly give out some recommendations.
So now let's begin with the core of your research journey. So what global challenge did your research address, and what's the most significant findings of your research?
Our report was aimed to influence or to help policymakers there inform themselves of the current gaps in disability. The main findings, I'll summarize it in one sentence, is that there's long ways to go. There's a lot of opportunity for improvement when it comes to healthcare infrastructure. So giving women with disabilities access to any healthcare facilities. I'm talking about roads. I'm also talking about having ramps available or a braille, sign language interpreters, etc. But there's also improvement in the healthcare curriculum that healthcare professionals get. Not all of them are educated on how to treat people with disabilities, let alone women with disabilities when they're pregnant. There's a lot of room for improvement, and we were able to pinpoint specific places in which policymakers could invest more time, energy, resources to improve the healthcare for these women.
So the global issue we tackled is the shortage of hospital beds. In this phenomenon, it is particularly severe or challenging in developing countries, and over 60 countries worldwide, including Ghana, fall below the World Health Organization's recommendation of having 5 hospital beds per 1,000 people. So in Ghana, we only have 0.9 beds per 1,000 people, and this phenomenon is known as the no bed syndrome. It stands for the shortage of hospital beds, and this shortage impedes patients' access to quality health care, leading to hospital overcrowding, heightened health risk, and even sometimes leading to death. We examined the Ghanaian healthcare system. We wanted to know how the structure influences the no-bed syndrome, and also reinvestigated the causes and effects of the bed shortage. And finally, one important aspect of our research was also to explore the existing solutions or interventions and look at why they didn't work and how they sought to mitigate the issue in tertiary hospitals especially.
The focus of our research was on two SDGs. One is climate action, and the second was reduce inequalities. I think when we say climate change impact, usually Toronto wouldn't be up on that list. You think of island nations who will face the more direct impact. But Toronto will be affected. The globe as a whole is warming, and it's going to have impact on Toronto as well. But what ends up happening is this impact is not equal across the board. So Toronto is a huge city. It's a patchwork of different neighborhoods, and certain neighborhoods will be more affected. And typically, these neighborhoods are those that have disproportionately Black and racialized communities. So there's currently a strategy at the municipal level called the Transform to Net Zero strategy, which has all targets and markers about how do we get to net zero. So one specific thing from this strategy, one of the target is all of the buildings in Toronto need to be retrofitted. But Toronto as a whole is a very renter city. So what ends up happening is this policy comes into place, the owner gets a notice from the city that says, hey, you need to retrofit your apartment or retrofit this building. The owner's like, great, this is a lot of additional cost for me to retrofit the space. So what am I going to do? I'm going to increase rent and pass that cost on to renters. So this is how you, at the end of the day, you're increasing cost for the end user. And I feel like that's where the policy falls short, where again, Toronto recognizes climate change as an issue, but doesn't really map out the extent of subsequent issues it's going to cause.
So one of the additional findings, the kind of unintended almost findings that we had during our research, was that we realized that there's a huge misalignment between the interpretations that policymakers have of the women's issues and the issues themselves. And so we realized one of the most important things that we could do with our research is really converge some of these ideas. And how we did this was by organizing knowledge translation workshops. The aim of these workshops was really to let policymakers know of the actual issues on the ground. And we did this by bringing in women who actually provided the testimonies of the issues that they were facing. And the way we structured the workshops was that, there was a presentation, of course, of our research, but most importantly, there was exchange between the different groups. So they were actually able to talk about the issues and really refine what the issues on the ground are to have a solid base and foundation of understanding of what the policies could actually solve.
One thing we realized is usually well-intentioned policymakers believe they have the right solutions, believe they have the expertise, and consultation with the community is more like a checklist exercise wherein we have an idea of what solution we want to go with. However, in our work, we realized that there's so much incredible work being done at the community level already. One way we kind of summarized in one of the articles we wrote is true accountability is doesn't come from imposing solution, but it comes from creating conditions for communities to lead. And I think that's at the heart of the issue.
I would say to summarize the research, I would look at the potential to give quality access to healthcare when it comes to especially the less privileged, but overall the entire population.
I'm really keen to know, how did you ensure that your findings were not just published, but actually used by those who needed them?
The collaborator, they are Youth Climate Action Toronto. They have been working very closely with the City of Toronto, and we're in charge of working on this youth engagement strategy. So they invited us to essentially contribute our insights on climate action, specifically impacting Black and racialized communities within this report. It's going into this official document that the City of Toronto has to look at, has to understand, and then has to publish and commit to, but that's not the end. Imar Rolston, shout out to him, incredible faculty mentor. He works at the City of Toronto as well. So we're looking forward to scheduling meetings with specific divisions in the city. So what we're hoping to do is go to them, present our research to them, and showcase to them how all of these different divisions or areas are interconnected. Even though our project has technically ended, we're working on op-eds for different publications, customizing them. We are working on a longer piece for another journal. And even personally, in my work in the provincial government, or my team are constantly talking about this research. So I think just that personal knowledge translation within your networks is also useful.
So we ended up with another partner to go ahead and use this for our capstone project to build a health information management system, which captured the bed management aspect of the hospital within the system. And I think this was very impactful because we got the opportunity to engage with the users itself, identify what are the issues, the current issues, what has been done before that didn't work, and how we can leverage technology to make it more efficient in terms of operations.
Thanks so much for sharing that with us, Joki. Laura?
I'd actually like to ask you first because you seem very enthusiastic about this question. So I was wondering what your team did to translate things.
Thanks for that, Laura. So once the case study was published, we shared that with our partner, and they used that document to pitch an idea to share and expand Atmiyata to other rural areas that needed that intervention. For instance, Mehsana, which is the village that we went to, mental health is not talked about. So it was super useful to know that this kind of intervention is being used.
Super interesting. On our project, I mentioned it earlier, but we were successfully able to carry out 2 knowledge translation workshops. And I have to, first of all, give credit to my incredible team. We're able to get in total 86 participants. We made sure to print condensed versions of our report, like one-pagers that they could take with them, that they could read during the workshops themselves and exchange about. And it was really funny because our research partner, Ridaya, afterwards, he told us that the one-pagers were quite popular. So a lot of people took them home. And that's really good to know also because it demonstrates that there was some sort of interest for the findings as well. On kind of a more academic note, Francesca was able to write her thesis on this topic as well. And she focused specifically on the stigma-related aspect of healthcare for women with disabilities. And Savo was able to write a paper more focused on the medical aspect.
Thank you to Laura, Jochebed, Ibtesaam for joining us on the show, and to Anila for co-hosting episode 5 of the Insights to Impact podcast. As the show's producer, it was absolutely lovely to learn about all of your incredible work that you have done as REACH researchers and now alumni. How you and your respective teams, through knowledge translation, brought back the insights from your reports to the hardest to reach communities. As you said, Anila, research has the power to change lives, but only if we make it accessible, actionable, and engaging. So let us continue challenging those norms and delivering insights to spark policy changes in local communities. I'm Catherine Jemay, and you are listening to the Insights to Impact podcast. Stay tuned.